We have now got a sheet that I change probably every month or two on the supplements you need, not only to heal the brain injuries, that's why we did it, but to keep your brain sharp and healthy forever. A doctor in San Francisco called Bredelson has come up with a protocol which now cures Alzheimer's disease. And 90% of what he's doing is what we've developed separately and independently in our brain protocol. So I thought that's interesting. We're healing brain injuries, we're keeping brains healthy, and now he's curing Alzheimer's. It shows the importance. And what does he do? He was a neurologist, didn't cure anybody, and he went in functional medicine, which is what I do, hormones and supplements, and he's getting people better. And it's a radical new thing, but it works. And everybody knows somebody with Alzheimer's and they're worried about it. So what's on my sheet? Well, the first thing on the sheet is vitamin D. Vitamin D is not a vitamin. So they messed up the labeling. It's a hormone. The definition of a hormone is made at one site, you make it in your skin, used at another. It's used in bone, breast, brain, and all throughout your body. Why are 95% of Canadians short of vitamin D? It's also 95% of Americans. Why are they short? Well, vitamin D comes in international units. So 1,000 international units of vitamin D, like 1,000, that sounds like a lot. So a lot of my patients are on 1,000 international units of vitamin D a day. They're sitting back like that's a large amount. That 1,000 international units equals 1/40th of a milligram. So if I said I have a drug or a supplement that reduces 17 different cancers, will help prevent Alzheimer's disease and works as well as Prozac and head-to-head studies to improve your mood, and I'm going to put you on 1/4 of a milligram, most people say, that's not very much, doc. If I translate it into 10,000 units of vitamin D, 10,000 is way too much. It's the same amount. So that's one of the reasons Canadians are short of vitamin D, including those taking supplements. Well, I just take them in the winter. 95% of Canadians are short of vitamin D all year round. So 1,000 is very little. Our usual starting dose is 5,000 international units of vitamin D. One of the reasons why people are short is that in Canada, you can only get vitamin D in tablets, or you can get a liquid form, but there are 1,000 international unit measurements. And so that's saying, that's a lot, when that's not the case. In the United States, you can get vitamin D tablets of 5 or 10,000. And so it makes it a lot easier to take. The other huge problem is that vitamin D is a fat-soluble vitamin, and most people aren't told that. What does that mean? If you don't take it with fat, you won't absorb any. So I have people saying, well, I take my vitamin D with fat. Okay, what do you take it? Well, I just take it with a meal. We've looked at so many meals. People that do that don't have good levels of vitamin D. How do you establish a good level of vitamin D? The range of vitamin D in the lab, 75 to 250. Remember that 75 is in the bottom 3% of the population. Would you like to score 3 on your health exam? No. So you have to be up levels over 150 and probably closer to 200 to get good levels. And what do you need to do that? Most people, we start with 5,000. There's the odd person we can reduce a bit, but most of them we put on higher doses. I'm on 10,000. I know what my blood levels are. That's an ideal level to reduce 17 cancers. One study shows an 84% reduction in breast cancer. Why are 95% of Canadians short of vitamin D? And I even get letters from doctors. How come you put my patient on this huge level of vitamin D of 2,000? And I write back, that's a 20th of a milligram. So you can't be afraid of the vitamin D. Then you hear, vitamin D toxicity. I've never seen it. And there are now articles talking about the myth of vitamin D toxicity. When 95% of people are short of vitamin D, you shouldn't be worried about high levels. The thing you can do to also counteract one of the things with vitamin D is you can reduce the calcification in heart valves and blood vessels by going on vitamin K at the same time. And surprisingly, vitamin K, which most people don't take, and if they do, they don't take it with fat, it's another one of the fat-soluble vitamins. So you're taking the fat, and what do we suggest? A tablespoon of either olive oil or coconut oil or medium-chain triglyceride oil. MCT oil comes from coconuts. It's refined. It has no odor and no taste. So I put that in my black coffee. I have that. I've got my tablespoon of oil. Then I take my vitamin D. So that's one way you'll know you take it. In the States, you can get the vitamin D mixed in with a vitamin K, so you've got your vitamin K right away, and it's all in one neat little package. In Canada, if you buy them separately, you want 150 to 200 micrograms of vitamin K that you're taking with your vitamin D dose. And the vitamin D dose is selected depending on how you react and what your blood levels are, and that's the only way you can do this.